This is the end of the lecture of the Cryotherapy Beyond Immediate Care, and there's not a ton of information here left that we really haven't talked about at some point in the class, so I'm not going to go into crazy detail on some of it, but I just wanted to kind of give an overview on some of the components that maybe you guys hadn't remembered or just maybe wanted some extra help in trying to figure out before you read this and prepped for the exam that's coming up soon. So we talked about the lymphedema pump. An idea of this is that game ready unit. So as you can see in the picture, the patient is having this chamber on. The hoses are attached, and this could be one of two different ways. This could be one where it all fills up with compression at the same time and can have an ice effect to it, which is the game ready unit. This can also be a unit more like the Normatec, where it goes in its sequential pulsating pressure throughout the joint from an area of high concentration to low and then back and forth to try to give the idea of that pump or that compression that we talked about with immediate care and getting all of that swelling and secondary injury out of the area. And like I said, a lot of times these do have that ice bath, so it doesn't get as cold as we would want to as far as like an ice bag would, but it has the ability to keep at a fairly constant temperature. It does kind of change a little bit because the ice will melt, but you are able to adjust. So on the game ready unit, you can adjust from what they call 1 snowflake to 3 snowflakes, which is approximately 36 degrees to about 50 some degrees that you can have the water going through. There's also different variations of how much pressure. So in the game ready unit, you have a light compression, a medium compression, and a hard compression. And so for a patient who has a lot of swelling or is new or has an acute injury, you may want to use something similar to the light compression. That way you're not forcing too much pressure in that area because you don't need much pressure for it to go. And as I talked about, it's not just pressure along the joint, but it also can have that pumping effect to it. They also have the idea of an on-off mechanism. So this was fantastic. I had surgery in January and had to go on a long bus ride with the sports team I was working with. And so, you know, in a bus after an acute injury is something that's going to be pretty painful. So I was able to actually turn this machine on for 30 minutes on, 30 minutes off. And I could try and sleep on the bus because we did an overnight trip, and that ice and compression just ran all night. And so I was able to try and mitigate some of the swelling that could come into that area, which would then lead to edema. This also has the idea of kind of where we're working to with cryokinetics. So we talked about cryokinetics and the idea of wanting to get up and move. Well, having this muscle pump is actually creating that venous flow, is causing the muscle to contract a little bit underneath the surface without you actually having to do anything for it. And it does have some of the benefits of it. We talked a little bit in class about contrast baths. So as the name says, contrast, you're going to go from something that's really, really hot to something that's really, really cold. And the idea is that you're going to quickly vasodilate in something hot, and then you're going to go to the ice and you're going to vasoconstrict, and then back and forth and back and forth. There's various times of how you can do this. You can do 4 to 1 or 3 to 1 or 3 to 2, 5 to 2. Those are just some examples I gave you of, oh, you're in ice for 4 minutes, now you're going to go into heat for 4 minutes, or you're heating for 4 minutes and then you're going to ice for 1 and back and forth. This modality is actually not strongly indicated in the use by the research. It just doesn't actually do what we thought it would do with the vasoconstriction and vasodilation. So there's a lot of issues. So we thought that they could remove some of the free proteins from the lymphatic system working. That actually hasn't been shown to actually do any of the work that it says. The tissues, as we talked about in class, remember, you have to have cold on for a while before the tissues are going to get cold. Same with heat. You have to have it on for a little bit before those deeper temperatures are going to get warmed. And so when you're quickly going back and forth, you're not giving that tissue that time to either heat or cool, so it's not getting any of the benefits that we thought. So you're kind of just applying a modality without a real purpose to it. We know that there's really nothing that's causing the constriction or dilation to occur because it's not in long enough, and we know that there's just not enough basically time for this to work. We talked a lot in class about how recovering cryotherapy is beneficial, how you all felt that you felt a lot better after you work out to be able to go have some ice on. And a lot of this is the idea of that mental theory. So you have the idea of like the whole team needs to come in for ice baths, or you're going to have a feel-good benefit to it afterward. like I said, there's very limited evidence. Actually, most evidence supports that, doing things such as ice baths after workouts or things like that really doesn't affect the muscles that much. We talked about this in class already, so I'm going to just kind of quickly go over it, but we had the whole body cryotherapy and then the cold water immersion. So the whole body cryotherapy, those are those chambers that you can go in, and they're super expensive. They control the air for very short bits of time, and this is a lot of pro athletes like this idea. We have the idea of the cold water immersion, where the patients will go into water or whirlpool or troughs, and they're gonna sit up to around their waist, mid chest area, and are able to be in that cold water for usually about a 10-minute time. So do we use this, do we not? So basically people are looking for any way to get ahead in their sport, in their participation in their weekend athletics that they can. And so honestly, even if this does not work scientifically, if people think that they're getting better, or if they see that LeBron James was in an ice bath post-game, then they are going to mentally believe that they're going to get better from it. And so we talked about that with patient-centered care, how that's a crazy important aspect, because we know the general population is going to follow whatever the professional athletes do. The heat versus cold. I'm going to have you guys come back and look at this. We're going to have that debate in class, and so I think this will be some really important information for you guys to take with you post the debate. So in acute care, from a cryotherapy standpoint, acute should be ice all the way. And I know we're going to talk about heat in thermotherapy and in our debate, but in the traditional sense of how everything works with cryotherapy, it is heat all the way. And sorry about that popping up in the middle of this. As we kind of move on, that transition to care, so that subacute phase, that's where we're able to kind of add a little bit more variance into the modality. So we know that exercise is actually going to be the most important part within this transition into care. And as we go into post-acute, we know that there's going to be benefits to heat, and we talked a lot about that within the thermotherapy lecture that we had. After 10 days about the injury, cold is just basically going to be that feel-good, that idea of maybe decreasing some spasm and decreasing pain if there is any from the soreness. And we know that with chronic or overuse injuries, it really doesn't do much. There's not the hypoxic injury, but some people will feel the benefits from it. You do have to watch, because sometimes it can overactivate the inflammatory response to actually then decrease it. But as a clinician, I definitely use ice with chronic or overuse injuries for mainly the pain effect. And, kind of as we go about, it's kind of up to the athletic trainer. So we know that it's going to depend on what you want to do. A lot of times I'll do ice on 30 minutes every hour, or 20 minutes every 2 hours, things like that. And it's very much like we talked about for the area that's been damaged. So we talked, just a kind of a recap, we have cryokinetics, cryostretch, connective tissue stretch, cold compression devices, and contrast baths. So those are going to be some of the important types of cryotherapy for you to understand. And heat or cold? I'm up to you. When do you think? Why do you think? And I'm excited to hear your responses in our debate. And please let me know if you have any questions from the completion of this presentation.